You feel it before you understand it, a pressure so deep it seems to come from the center of the earth. Your body is doing something it has been rehearsing for millions of years, and there is no hospital, no epidural, no doctor standing by with a monitor and a plan. There is only the ground beneath you, the people around you, and something ancient and unstoppable moving through your body. For roughly 300,000 years, this was how every human being arrived on Earth. Modern childbirth feels like a medical event because we have made it one. And we had good reasons to. But before hospitals, before sterile rooms and surgical lights, something else was happening during birth, something that anthropologists are only now beginning to fully reconstruct. And what they are finding might surprise you. Let us start with what your body actually is. You are, in anatomical terms, one of the most dangerous mammals to give birth. The reason goes back roughly 2 million years. As your ancestors began walking upright on two legs, the pelvis changed shape, it narrowed, it tilted, it became optimized for striding across open savanna. At almost exactly the same time, the human brain began expanding at a rate with no parallel in evolutionary history. The result was a collision, a large skull trying to pass through a narrow, reshaped canal. Anthropologists call this the obstetric dilemma. It is the unavoidable tension between a body built for walking and a brain that became too large too fast. Karen Rosenberg, an anthropologist at the University of Delaware, has spent decades studying the shape of fossil human pelvises and what they reveal about ancient birth. Her work, often conducted alongside Wenda Trevathan, shows that the human infant has to rotate as it descends through the birth canal, emerging facing backward relative to the mother. This is almost unique among primates. Chimpanzees, gorillas, and most of our primate relatives give birth with the infant facing forward, making it easy for the mother to reach down and guide the baby herself. Human infants cannot do that. The rotation means you cannot safely deliver yourself. You need help. Trevathan calls this the cooperative birth hypothesis. She argues that the need for assistance during birth is one of the oldest and most powerful forces driving human social bonding. Before agriculture, before language was fully formed, before fire was controlled with any reliability, your ancestors were already turning to each other during the most dangerous moment of their lives. They did not do this alone. So, what did birth actually look like in the deep past? Picture yourself somewhere in sub-Saharan Africa, roughly 100,000 years ago. The camp is small, maybe 15 people. Extended family, close kin, one or two individuals who have attended many births before. When the contractions begin, you do not leave the group. You move toward it. The women who have done this before come close. They know the sequence by feel. They know what sounds are normal and what sounds mean something is wrong. You are not lying on your back. That position is largely a modern invention useful for surgeons and physicians, but not especially natural for the birthing body. Evidence from contemporary hunter-gatherer societies studied by researchers like Marjorie Shostak, who documented the life of a Kungsan woman named Nisa in the Kalahari, suggests that women in foraging societies commonly give birth in a squatting or semi-upright position. Gravity assists the descent, the pelvis opens slightly wider, the whole process tends to move faster. Shostak's documentation of Nisa's account, published in 1981, remains one of the most intimate first-person records of a traditional birth ever recorded. Nisa described laboring alone in the bush, a common practice among the Kungsan. In some circumstances, though midwife-assisted birth was also documented. The details she shared were frank and visceral and entirely without the softening language modern culture tends to apply to birth. It was painful, it was powerful, and the community was waiting. The role of the midwife is older than any written record, far older. Janet Chawla, a researcher who has studied traditional birth practices across cultures and centuries, has documented how midwifery knowledge was passed orally through generations of women long before any formal medical system existed. The techniques were not random. They included massage to help reposition a poorly aligned infant, specific positions to encourage progress, plant-based preparations used to stimulate contractions, ease pain, or slow excessive bleeding after delivery. The plants were not guesswork. Ethnobotanical research, including studies by scholars like Daniel Moerman, who compiled thousands of records of Native American medicinal plant use, shows consistent cross-cultural patterns in the plants used for labor and postpartum care. Blue cohosh, raspberry leaf, shepherd's purse for hemorrhage. Your ancestors were not simply enduring birth. They were actively managing it with the pharmacopoeia available to them. And they were doing it in a world without the concept of a sterile field, which raises the obvious question, how often did it go wrong? The honest answer is more often than today, and less often than you might assume. Skeletal evidence from sites like Çatalhöyük in modern Turkey, one of the earliest known large human settlements dating to roughly 7,500 BCE, reveals that women in early agricultural societies showed significantly higher rates of stress markers on their bones than women in hunter-gatherer populations. Agriculture counterintuitively was hard on women's bodies, the diet narrowed, the workload intensified, nutritional deficiencies became more common, and those deficiencies affected bone density, pelvis shape, and birth outcomes. In other words, the transition to farming made childbirth more dangerous, not less. For most of the hunter-gatherer period that precedes agriculture by hundreds of thousands of years, women were generally well-nourished, physically active, and gave birth to infants spaced further apart. Sarah Blaffer Hrdy, a primatologist and anthropologist at the University of California, Davis, has argued extensively that the alloparenting system of early human groups, the practice of multiple adults sharing the care of infants, was a central adaptation that increased infant survival. Grandmothers, aunts, older sisters, unrelated women in the band all participated in raising children. The mother was not alone. Hrdy calls this the cooperative breeding hypothesis, and it has significant implications for how we understand birth survival. When a mother was incapacitated during or after labor, others stepped in immediately. The infant had multiple caregivers whose biological responses were primed by the presence of a helpless baby. The group was the safety net. Now imagine the moment just after birth. The infant arrives covered in vernix, a white waxy substance that protected it in the womb, and it is placed immediately against your skin. Skin-to-skin contact triggers a cascade of hormones in both of you. Oxytocin rises sharply, the uterus begins to contract, breastfeeding begins, which further drives the contractions that help expel the placenta and slow postpartum bleeding. Your body and the infant's body are still in active biochemical conversation, a conversation that evolution has been refining for millions of years. The placenta itself was not simply discarded. Across cultures and throughout history, the placenta has held symbolic and sometimes practical significance. Some groups buried it, some used it in ceremony. The specific practices varied enormously, but the consistent thread is that this organ, which sustained the infant for 9 months, was not treated as medical waste. And the infant you are holding is not a finished product. Human infants are born dramatically more helpless than any other primate. A foal stands within an hour of birth. A chimpanzee infant can cling to its mother within days. A human newborn cannot hold its own head up for months. It cannot walk for a year. It is dependent in a way that has no parallel among our closest relatives. This is because birth had to happen early. The obstetric dilemma forced it. If the infant stayed in the womb long enough to be as neurologically developed as a chimpanzee, at birth, the skull would be too large to pass through at all. So your ancestors were born early in a state of almost radical dependence, and the community absorbed that dependence as a shared responsibility. The village was not a metaphor, it was the survival mechanism. Modern birth in a well-resourced hospital is genuinely safer than any alternative that has existed before it. Maternal mortality rates in high-income countries are lower than at any point in human history. That is not a small thing. It is one of the most significant achievements of the last 2 centuries. But something has also been lost. Studies by anthropologist Robbie Davis-Floyd, published in her landmark work, Birth as an American Rite of Passage, document how the medicalization of birth moved it from a social event to a clinical one. The laboring woman went from the center of a circle of known people to a patient in a system of protocols. The midwife, who carried centuries of embodied knowledge, was gradually replaced by an institution. The result is that many women today report feeling alone in the room where they are surrounded by people. Your body has not forgotten what birth is supposed to feel like. When contractions peak and the ancient pressure moves through you, what rises in most people is not a desire for quiet and sterility. It is a desire for known faces, for a hand to hold, for someone nearby who has done this before and who tells you without words that you will come through it. That impulse is 300,000 years old. It is not irrational, it is not weakness, it is the oldest collaborative act in human history written into your biology at the cellular level. You feel it before you understand it. That pressure, ancient and total, moving through a body that was shaped by millions of years of exactly this moment. And somewhere in every delivery room and every birth center and every place where a human being arrives into the world, the group is still there, changed in form, but not gone. It was never supposed to be something you did alone.